Summer's coming up, and men with large breasts will be avoiding the beach. For men who suffer from this condition that we're going to have a conversation about here, even taking off their shirt in the locker room in front of their buddies is too embarrassing, never mind in front of females on the beach. For males of all ages, gynecomastia can totally shatter their self-esteem and confidence, and we welcome Dr. Peter Bray, the first plastic and reconstructive surgeon in Canada offering male breast reductions to the program.
Hi, Dr. Bray. Thank you for joining us.
Thank you so much for having me.
Can you tell us exactly what is gynecomastia?
Well, literal translation means female breasts. In a man, that means breasts that are excessively large. So, in a simple description, that's what it is. Often it's a result of a mild hormonal imbalance, but there can be other medical causes. But it's an extremely common problem, both in younger and older males.
An extremely common problem?
Yeah. Can be upwards of 40 to 50% of the male population, particularly in adolescence, but often in regular, healthy, otherwise normal guys can have the problem commonly also.
So what size are we talking about when we talk about gynecomastia?
Yeah, well, there can be a huge range from, just maybe a centimeter or two of extra fullness to what arguably look like real female breasts. Now, in the latter, that would usually be some medical hormonal imbalance, but it can be very dramatic in some men.
Interestingly, because I've noticed, this is going to be probably just a little outside there, but watching the television show 2.5 Men,
yes,
the younger brother, Alan, I notice when he has his shirt off that his breasts seem a little fleshy.
Yeah.
And he seems to be, pretty toned, not buff. But so I'm looking at that and I'm wondering, okay, is that because of weight? Is it because is it always just hormonal? I mean, is there a weight issue in here as well?
For sure. So increasing weight or being overweight, the breasts absolutely will get bigger too, and mostly composed of fat tissue. But even in men, the breasts have what I'd call mammary glands or actual breast tissue.
Really?
Yeah, and in women, this is what enlarges and would produce milk in pregnancy. Mm-hmm. Men still have them too, but to a much lesser degree. But they can enlarge in the presence of hormones or some medications too. So fat's just one aspect, the breast gland.
So we're not talking then. There's a pressure on men now to probably more recently to look better, to look trim. This isn't cosmetic then. This is why are they coming to have reductions?
Well, the big issue is self-esteem, and let's face it, increasing breast size we very much associate with women. So that can really have an effect on men. It may be almost the equivalent of having a bit of a mustache on a woman. And, it's not necessarily a medical problem in them, but boy, they sure don't like it all that much.
40 to 50%, you're saying it's common, and in younger men too. Is it something that you grow out of or into? It changes with age?
Yeah, in adolescence is a prime target for young men when the hormones are in flux and the estrogen, testosterone are working their way out. Most adolescent men will have a bit of gynecomastia, but typically do grow out of it. But in middle-aged men or men that are otherwise completely healthy, some of that breast tissue may persist or may enlarge also, and these can be healthy guys active at the gym at a good healthy weight. You still have a bit more breast fullness than they'd like to see.
Is there any connection between this and any type of male breast cancer?
No, none identified. So it's not putting men at an increased risk of cancer, but that's absolutely something we'd think about. In a man who's noticed a recent change, perhaps in one side only, have to rule out all those important things and make sure there's nothing else going on.
Well, we do want to talk about some of the psychology of this as well. And
800
Gynecomastia surgery, or male breast reduction, fast becoming one of the most popular cosmetic surgeries among men. It is the procedure that treats the dreaded man boobs. Quite a common condition, as we've been finding out, and can be found in up to 40% of all males. Dr. Peter Bray is our guest, the first plastic reconstructive surgeon in Canada offering male breast reduction. And I have to ask, Peter, if this isn't something that we could take care of physically, though. Can we peck up, like do the right exercises to fix these things?
Well, absolutely. That's a good place to start, is to achieve a healthy lifestyle, reduce any excess or obesity, and definitely work on muscle definition of the pectoral muscles. That's a good base. And most of the men I'm seeing have already done that, but there remains a pocket of breast tissue, some fullness there that they just can't shake. And that's when it becomes really frustrating for them, because they've put in all this work, but still can't quite get the final improvement that they're looking for.
Well, and how does the surgery work? Is it just like a female breast reduction, or is it just liposuction? Or
it's quite different from a female breast reduction. And just to correct your information there has been male breast reductions being performed in Canada. I'm the first to be using a new technology called BodyTITE, which combines a liposuction technique, suctioning away fat, but also using energy to melt and soften the tissue so it comes out gently, but also tightening the skin at the same time. Differs from a more traditional male breast reduction is that I can tuck the incisions more discreetly out near the armpit and don't have to make incisions or cuts on the front of the chest, which can be a real issue for men. They don't want large breasts, but nor do they want visible scars on their chest. That can be a telltale sign of surgery.
That's just fascinating. Does this technique work at all for women?
For sure. I use it in women in lots of other areas for removing fat, improving the contours. It can be used for a moderate breast reduction in women if they don't need a lot of lifting at the same time. Mm-hmm. But in women, they're typically so much larger that for a true reduction, they need a more traditional one, where there are actually scars made on the front. Yeah,
because you have to almost you have to.
There can be a lot of reducing in weight, also lifting the nipple area up into a higher position, and they can sometimes have a tremendous amount of loose skin that's more than this minimally invasive technique could improve.
We get to some of the psychology of this too, as men, as we've been suggesting here about the beach weather coming up and even the locker room. What have you been dealing with psychologically with some of these patients?
Well, most of the men coming to see me, they've been thinking about this and brooding about it for 10, 15 years before getting the courage to come and visit with a surgeon. Now, I think the internet has helped a lot, that there are chat forums, online information where a lot of the discussion can happen anonymously. So that's been a bit of a liberator. And I think men are realizing that they don't have to suffer silently, that there are options available, and that they can definitely do something to help with the problem.
And we're seeing more of it because it's more accessible now and there's this new technique.
I think that's one factor, and we may also be seeing more of it, just the overall mentality of men, less of a stigma associated with visiting a plastic surgeon.
And how are the men, how do they, you see them afterwards, post-surgery or post-treatment, do they notice a change in how they feel about themselves?
Oh, yeah, absolutely. One of the most gratifying things I'll hear is that it's been a life-changing procedure, a life-changing intervention. And, I'll quote one of my recent patients who said it's the best thing he's ever done for himself in his entire life. So it really can be quite a liberator for a lot of these men.
But you say it's often happens when they're teenagers and they'll grow out of it. What ages are you seeing?
It's mostly men, middle-aged, 40s, sometimes 50s.
So they've been sitting with it for a long time.
Yeah, that's by far the most common for me. Now, there are definitely young men still in their teens who are very, very affected and traumatized by it and want to have something done sooner rather than later. But for me, yeah, definitely mostly in their middle age.
All procedures, I think, plastic surgery or procedures for men have increased about 121%. I've seen that figure. What about this procedure? Give me some numbers. How many men are having this done?
Oh, it's been a big increase in the last, I'll say, 5 years, becoming one of the top 3 most common procedures for men, and that would apply to statistics from the States and also in Canada. I couldn't give you numbers for Canada off the top of my head.
10, 20,000 maybe?
It'd probably be less than that, but it's definitely in the thousands.
It's interesting.
Yeah.
Very interesting. Dr. Bray, thank you very much.
Oh, thank you for having me.